According to the Access to Care data from the 2016 State of Mental Health in America report, 6 out of 10 do not have access to mental health treatment. Access, funding, and fear of stigma are barriers to high-quality mental health care that help people cope with traumatic events. Here's a clip from Representative Pat Kennedy.
It was shortly after my parents got divorced when I was 13 that I was taken to see my first psychotherapist. I think my parents were just concerned about my emotional growth and worried about what this would do. I was less apprehensive about seeing a therapist when I was 13 than when I was in my 20s. I was feeling more stigmatized as I grew older because I kind of felt like I should have gotten a handle on this. I even parked my car like 4 blocks away from my psychotherapist's office. And that, I think, is the big kind of conundrum in these illnesses, is that if you have a chronic illness, like I have, been diagnosed with severe depression, bipolar disorder, general notion is if you have to keep going back for care, you're somehow failing, as opposed to, no, you're winning because you're maintaining your recovery. Thankfully, because of the law I had a part in authoring, we're now required to have mental health be offered in every health insurance plan in this country. We're in the golden age of discovery in neuroscience, and it's going to be accelerated from places like the Child Mind Institute, which are marrying all the science necessary to understand brain and behavior. My uncle started the moonshot 50 years ago. It went to outer space. We need the race to inner space. This is the most important thing, not only to each of us as individuals, but to our families. And the Child Mind Institute is giving us a path by which we can have greater confidence and hope, not only for our kids, but for the whole society at large.
Research makes clear the association between trauma and negative behaviors and illness. When damage occurs to the psyche or brain, many negative behaviors or outward symptoms are presented by the person who suffered trauma. Research that looked at the 2011-2012 National Survey of Children's Health, where data from 95,677 households was analyzed for links to ACEs and several factors. The greater number of ACEs a person experiences, the more likely they will suffer health problems, and more likely the health problems will be severe. Traumatized children can become hypervigilant, where they don't trust people or their environments, withdraw, or act out. Children with 2 or more ACEs were over 2.5 times likely to repeat a grade. Adding to the significance and reality of ACEs data is the science of brain imaging. Since the 1980s, images of brains have been confirming and validating the studies which have shown significant correlations between ACEs and deterioration of many aspects of life: security, contentment, success emotionally as well as financially, health, and longevity of life. Brain imaging is allowing neuroscientists to see the structural and functional changes of the brain. Consistent findings of brain images that compare normal children with trauma-afflicted children is different regions of the brain decrease in size, as well as the activity of different regions lessen in trauma-afflicted children. The main regions of the brain that are talked about in the literature are the corpus callosum, hippocampus, and the amygdala. The corpus callosum allows for communication between the 2 hemispheres of the brain. Here is a 2-minute video clip illustrating that role.
Welcome to 2-Minute Neuroscience, where I explain neuroscience topics in 2 minutes or less. In this installment, I will discuss the corpus callosum. To understand the role of the corpus callosum, it is first important to remember that the brain is divided into 2 cerebral hemispheres, right and left, separated from one another by a long groove called the medial longitudinal fissure. These 2 hemispheres are nearly mirror images of one another, but they do not function independently, and communication between the cerebral hemispheres is important for healthy brain function. The importance of this communication can be seen with the processing of sensory information, which is typically received first in one hemisphere and then must be shared with the other hemisphere. When you type on your keyboard, for example, information about the feel of the keys is sent up from your right hand to the primary somatosensory cortex on the left side of your brain. That information must then be shared with the right side of your brain as well. That's where the corpus callosum comes into play. It carries information received in one hemisphere over to the other, and in general allows for communication between the two hemispheres. The corpus callosum is a large, C-shaped nerve fiber bundle that stretches across the midline of the brain, connecting the left and right cerebral hemispheres. It makes up the largest collection of white matter found in the brain. The importance of the corpus callosum can be seen in patients who have had their corpus callosum surgically severed, usually to stop the spread of epileptic seizures. After the procedure, known as a corpus callosotomy, patients may display deficits representative of decreased communication between the cerebral hemispheres, such as the inability to name an object if it is shown only in the left visual field. This is thought to occur because information from the left visual field travels to the right side of the brain, while language centers reside primarily on the left side of the brain. Without the corpus callosum to connect the two hemispheres, the patient cannot place a name to an otherwise very familiar object.
The hippocampus is where memory is controlled.
Welcome to 2 Minute Neuroscience, where I simplistically explain neuroscience topics in 2 minutes or less. In this installment, I will discuss the hippocampus. There is a hippocampus in the temporal lobe of each cerebral hemisphere. The name hippocampus comes from the Greek for seahorse because when it is removed from the brain, it vaguely resembles a seahorse. Although it has many functions, the hippocampus is best known for its role in memory.